do you think if we continue to push down this direction of blockchain, as I do, and I think it is a great foundational technology, that we will see a transformation in the way that people interact with the health system? And our health systems really, are they ready for that? And how are they going to adjust to that?
Yeah, I think two things. I agree with you on the cultural change of who owns the data. And I'll answer the other question first. So I don't think it's going to change the way in which we have people own the information. I think it's going to make it where when we do process the information, we're decreasing the risk of duplication, sharing of information across multiple entities. So I look at it more of as an administrative cost reduction over, data transactions. And I don't think you're going to transact an entire medical record, especially if it has imaging data and everything else on blockchain. It's going to be for, certain sections of the record that make the most sense, where we have the most administrative overhead to identify things that need to be shared. So that's my 2 cents. Because I go back to, I agree with you on your philosophy related to customer needs to own the data. And I go back to in Mexico when we were implementing electronic medical records there. One of the things that has always stuck in my head from there is people would show up to the hospital and they would come with their medical record and they would have a full chart. And I was asking, why are they coming with all this stuff? And they're like, well, we don't actually own the record. They do. So they were coming with their own electronic. And I was like, well, do you have data on them? Well, yeah, we keep 2 to 3 years worth of operational data. So if they come, we have it, but we expect them to bring their chart and then we know everything about them. And if they go somewhere else, they grab that data and they put in the chart. Obviously it wasn't electronic at the time. This was in, the early 2000s. But the cool thing about it was it really got me understanding that, really the patient has to be the owner. It's their information. It's their chart. If they're going to Florida and Pennsylvania and California, shouldn't they have their medication list? Shouldn't they have their clinical history with them? Shouldn't they have all this information that if they go to the emergency room, they get the best care because they know everything about themselves? And I just don't think I think there's an ownership issue.